Hello there, and welcome to another episode of the Calm Within the Storm podcast, all about finding contentment within the chaos that is mental health.
Everything can change, even the world we live in.
This episode will be all about hormones versus mental health. And we'll focus quite largely on the menstrual hormone cycle and associated conditions such as PMS, PMDD, and more. Today's guest is Laura Teare-Jones. Laura suffers with PMDD and is actively trying to raise awareness of the chronic condition that so often goes misdiagnosed or even completely undiagnosed. Welcome, Laura.
Thank you.
Thank you for coming.
Thank you very much for having me.
So before we dive in, tell us a little bit about yourself and your relationship with today's theme of hormones versus mental health.
Okay, so I am Laura. I'm 32. I live in North Wales and I have a condition called PMDD, which stands for Premenstrual Dysphoric Disorder. So I've probably lived with this since I was around 14, so half of my life. But because the condition is primarily psychological and mental symptoms, it shows up as depression or anxiety.
So it's easily missed or easily confused.
Absolutely. So I lived with it for a very long time before I realised that my symptoms were actually connected to my menstrual cycle.
Ah, okay. So how did you figure out the correlation then? How long did that take you?
Well, to be honest, it was a bit of a light bulb moment. So I would never have found out about it if it wasn't for a friend of a friend sharing something on Instagram with kind of some stats and figures. And it was like a tick list of all the symptoms. And I went through the symptoms and just thought, I have that. And that was it. That was the moment that I found out about PMDD. And that was in 2019. So, as I say, it was a long time living with it before realising. And then I got my diagnosis not long after that.
And what was the diagnosis like? Was that a difficult process? Like, are there tests for it, or is it just logging things and tracking things and...
Yeah, there's no test to diagnose PMDD, but what I would say to anybody who thinks there's something going on is you might be asked to have tests to rule out other conditions, so don't feel like your doctor is fobbing you off, basically.
Okay.
So I didn't have any tests at that point, but over the last kind of 20 years I've had lots of tests for my thyroid, I've had medication for depression, I've had medication for migraines, I've had kind of various contraceptives to try and kind of balance out my hormones, and PMDD isn't a hormone imbalance, so none of these things were quite the right fit for me.
Okay.
And then when I found out about PMDD, I'd already been journaling my symptoms. I used to kind of blame myself. So, maybe I feel really bad today because I didn't go for a run last week. And, as people do, I think we can beat ourselves up, and there's so much emphasis now on self-care. And
yeah,
actually that's just not enough. But at the time, I would kind of track my symptoms to just try and work out a pattern. But yeah, I had no idea it was linked to my menstrual cycle. But then when I found out about it, I looked back and I could see just these patterns of symptoms and then no symptoms and then symptoms again. So I was able to just take that to my doctor and say, look, basically. Yeah.
And it must be quite confusing as well to see how frequently that's happening, because I think when you're tracking, for example, if you're going through low phases with depression or bipolar and bigger things like that, you find that the episodes and the highs and the lows tend to be over weeks or months or even years. And if you're logging everything on a daily basis and you find that you're going up and down and up and down on almost like every other week, then that is quite a significant find, really, that I guess distinguishes that from something like bipolar or something where it is a longer term cycle, if you know what I mean.
Yeah, and part of my kind of self-deprecation really was I would think that I had bipolar because the symptoms kind of seemed to fit, but then it wasn't quite the right fit. So then the self-deprecation would come in and kind of go, oh, you've just been a drama queen. Like, there's nothing even wrong. And so then you start in a cycle again then, and then you start to feel better again and think you've cured yourself with, you know, exercise and eating healthy. So yeah, that's kind of how it was for me.
Wow. And it's not a mild condition either. So I was having a look and doing a little bit of research into this and found out that 30% of sufferers attempt suicide, which is bonkers. And that doesn't even count the percentage of people who consider, like, have thoughts of suicide. That is just suicide attempts. Yeah. And 30% of women with PMDD, that's a lot. Yeah. That's a huge percentage.
Yeah. It's a staggering amount considering how little this condition is talked about.
Absolutely.
It affects 1 in 20. So the fact that it affects 1 in 20 means it's not rare. It's relatively common. And then when you hear a statistic like that 30% of those people are going to attempt suicide or have attempted suicide, it makes my skin crawl to think that it's not more known about, not more talked about. It doesn't make sense to me why it's such a taboo subject.
Yeah, absolutely. I mean, I'd never even heard of it until you raised this. And that's baffling. You know, women especially you'd think would know more about this subject. But no, it's that really surprised me. And I also found out that PMS affects 75% of women. But PMDD, is that a separate thing from PMS, or is it under the same bracket? And how would someone know if they've got PMS or PMDD?
Yeah, so PMS, I think when I think of PMS, I think of that kind of very stereotypical crying into a box of chocolates watching a sad film. You know, I think lots of people can relate to that and maybe feeling a little bit bloated. PMDD is debilitating. And it's not to say that PMS isn't, you know, PMS is in itself, it's tricky to live with. You know, sometimes it's really inconvenient to be a hormonal wreck. But PMDD is debilitating, and as soon as it gets to a point where it's interrupting your life, it's affecting your quality of life, that's when it becomes something that you probably need support with. It is a spectrum, so you could be at the PMS end of the spectrum, you could be at the PMDD end of the spectrum. And another thing to say as well is that every month's different. So again, you can if you're anything like me, you might gaslight yourself and say, oh, it's not even that bad. When actually that's a symptom of PMDD, to kind of talk like that to yourself. It's not even that bad. And actually, it is really bad. You might just be having a better month. And if you are, then go with it. So,
Yeah. So we've had a few questions that have come in from our listeners. And someone has asked, when things are bad, other than medication, what helps?
Oh, I love that. And this is probably like the question that everyone wants to know, because there's no cure.
Okay.
And treatment options vary from person to person. So some people contraceptive pills, some people SSRIs, some people chemical menopause, and then you've got the very extreme end, which is surgery.
Wow.
Yeah. And then you've got...
And the surgery, I guess, is that to have ovaries taken out? Or...
Yeah, so that would be a bilateral oophorectomy.
Right, okay.
So it's not a hysterectomy. So lots of people think if I have my womb removed, that would be the answer, but it's actually the 2 ovaries.
Wow.
And you can have the womb removed as well. It won't do any harm. But actually the emphasis on the ovaries, because it's ovulation that triggers the symptoms.
Okay.
But yeah, if you're not wanting to go down a medical route, there's a bit more holistic way to manage symptoms, and that's things like supplements like magnesium. St. John's wort is apparently helpful. But this is all kind of anecdotal, so people say that these things work. Unfortunately, PMDD is so under-researched that even things like the true effect of supplements isn't really known.
Right.
Which is why it's all anecdotal. For me, personally, there's 2 things that really help, and one of them is fresh air. I call it fresh air because I think as soon as you say a walk, you feel like you have to do it.
Yeah,
like
that's
exercise.
a good point.
And sometimes it's enough just to go and sit in the garden, or even just if you can't get up, open a window and let some fresh air in. You know, that's the starting point. Then try and make it to your garden, sit on a bench. Then maybe you'll go outside, and if you happen to move your legs and get some exercise, brilliant. But the one thing for me, and it kind of stems from that actually, is self-compassion. Okay. So I always say, if you're living with PMDD in particular, you're living with a mind that wants to destroy you from the inside for 2 weeks of every month. And that's hard. Yeah. And also it's a very real health condition. So what you must do is, first of all, accept it as a real health condition. But then balance it out. Try and balance it out with self-kindness or self-compassion. And I know those words are thrown around quite a lot now, and they're kind of buzzwords, aren't they? Like self-care, bit of a buzzword. But actually you must try and balance it out, because again, you don't deserve to have those 2 weeks of every month that are so horrific. So you must try and do something just to give yourself that boost, even if it's just making the best out of the best days.
Yeah.
Or trying to kind of do damage control on the harder days, treating yourself with self-compassion and just kind of giving yourself grace to feel what you feel, go through it and know that it will end.
Yeah.
They're the things that have got me through my darkest times. You know, it's not the medication. I do take medication, but it's not that. It's not the really medical side of things that have helped me. It's not therapy that's had that much impact. It's just some self-compassion and getting through it day to day.
Yeah. And that's got to be really quite hard, because I think hormones especially, at the best of times, can be erratic and crazy. Yeah. And you can wake up one day feeling very, very different from the day before. Yeah. And that can be really, really hard on the mind, because you don't know if it's the hormones, you don't know if it's actually you, you know, and with medication might be able to stabilize that, but you still, you know, any woman would be able to tell you when they've tried a contraceptive pill that hasn't worked for them, it can have such a massive effect on even just believing that you're a different person. It really transforms your way of thinking. And so to have a hormonal condition that has such a huge impact must be so difficult to be able to have that stability and recognize it's not me, it's just this condition.
Yeah, that stability, I think, is like the huge word there, because I always liken it to kind of being behind a thick pane of glass, and you can always see it happening. You can see yourself saying these things that you don't mean, or acting in ways that you don't mean to, but you just can't stop it.
Yeah.
And you feel so out of control, but it's so hard to actually kind of get back in front of it and say, right, let's just stop.
Yeah.
And I think that is why, for me, I like things like the fresh air and things, because it just gets me out of my head for a little bit.
Yeah.
And that's what I need.
Yeah. So we've already touched on this next question a little bit, but someone else has asked, how did you discover that what you had was different than standard PMS? So what was your journey with this?
I think when I look back, it's only kind of retrospectively that I kind of realised that a lot of things that I went through maybe as a teenager and when I was at uni weren't normal. So, for example, having those feelings of loneliness that a lot of people do get when they're in university, but taking over and consuming me. And that wasn't PMS, and as I say, I never even linked it to my menstrual cycle. I just remember having feelings in uni of just absolute devastation, grief, just not knowing why. And so for me, I never really linked it with PMS because I knew that PMS wasn't that.
Okay.
So for me, it was never kind of a question of, this isn't just PMS. Mm-hmm. It was more things like bipolar disorder.
Right, something more extreme.
Yeah, absolutely. But then again, when you start to feel better, you kind of think, oh, like, you're so stupid, like, you're such a drama queen. Yeah. And also thinking, like, do you know what, there's nothing wrong in my life, so why am I feeling like this? Why am I just being, like, attention seeking?
Yeah. That's easily done, I think, with mental health, is almost either blaming yourself and also blaming other people in, different aspects.
Yeah.
So someone else has said, do you notice an impact on your highs or just your lows?
I don't tend to have highs. So on my better days, I just feel good.
Yeah.
And I think that's why I knew it wasn't bipolar disorder, because I didn't have these kind of, these skyrocketing highs that just made you feel like invincible. I just feel good and I just feel happy.
Yeah.
So the lows are really significant, but the highs are just, I guess, how most people feel all the time.
Yeah. Another question says, does PMDD affect your fertility?
No.
Okay.
So PMDD isn't an endocrine condition. So by that, it's not anything to do with like your uterus, your womb. It's to do with the brain. So in a person with PMDD, hormones are usually normal. You can have a hormonal imbalance as well, but in my case, everything about my hormones are relatively normal. I have a 28-day cycle, normal periods, nothing untowards there. So PMDD is a severe reaction to hormonal changes in the brain.
Right, okay.
So as you go through your menstrual cycle and you hit ovulation, your hormones then peak and then drop. Mm-hmm. And that is what your brain reacts to. So it's actually a brain disorder. Wow. Which a lot of people don't realise, yeah. So therefore it's not actually linked to fertility or anything like that. But what I would say is a lot of people do find that they struggle with their fertility just because of things like trauma and stress.
Yes.
Which PMDD can bring on. So it doesn't directly affect it, but it could be, I guess, a consequence is the best way to maybe describe it. Which again is where your self-compassion and your self-care will come in really handy.
Yeah. And with it being a brain condition, as you describe it, I suppose, does that make it a risk of being hereditary, or is that not researched enough yet?
There's not a lot of research into it, but the research that there is actually says that yes, it's very likely to be genetic. So if you've got it, it might be that your mum had it or your daughter. And it's something I think about all the time. I've got a 1-year-old. And it's something that I think of all the time. Is she going to end up struggling like I have? But then I think, how lucky is she to have a mum who understands?
Yeah.
Whereas a lot of people just don't have that. I think the next generation hopefully will be a bit more lucky.
Yeah. And have you found from being diagnosed and talking about it with friends or family, have you discovered that anyone in your family has had it, or that your friends have got it, or is it still quite you don't quite know yet where you are with it?
I suspect. I have my suspicions about certain people. None of them have approached me. None of them have told me that they think they have it, but I do have people in my life who show signs.
Yeah.
And to be honest, I kind of think, do you know what, I'm not a doctor, it's not up to me to decide. However, if I can tell somebody's struggling, then I can tell they're struggling. And I guess for me, that's the main thing. I just want to be a supportive person in their life.
Yeah.
And they know about PMDD because they've listened to my podcast, they've seen all my work about it, so they know about PMDD. So I feel like they have the information, and now it's up to them to do with it what they like, and when they're ready as well, because I think for some people they don't want a label, they don't want to. That's
a big thing. I think.
Absolutely. A lot of people don't want a diagnosis because they don't want that label of being, a hysterical woman hanging over their head.
Yeah. So for anyone who's listening, who is maybe listening to this and thinking, it sounds familiar, I don't know where I stand with this. What are the major symptoms, I suppose? What are the most recognisable symptoms that are worth exploring or discussing with a GP as to whether you do have PMDD? What should someone look out for?
Okay, so first of all, the symptoms would be cyclical. So from ovulation to the start of a period, typically. So obviously they can run over by a couple of days. But you're looking at around 2 weeks of every month where your symptoms show. And those symptoms are predominantly psychological, so things like panic attacks, depression, I liken it, as I said before, to grief, because it's just that kind of all-consuming feeling of doom. And then insomnia, but also low energy, appetite changes, disordered eating is a huge one. And then there are physical symptoms as well, such as migraine, severe bloating. So yeah, if you were to take PMS and just kind of blow it up, basically all those symptoms, if they were to develop, would just turn into PMDD, basically.
Okay.
But again, I would say to anyone who is planning on speaking to their GP to track their cycle over a few months first.
Yeah.
Not only will that help you to get clarity, but also it's evidence for your GP. And unfortunately, with PMDD being such a new diagnosis, so it was only introduced as a real diagnosis in 2013, I think. So if a medical professional has had their training prior to then, they don't have PMDD training. So it's very easy for them to say, it's just PMS, or it's bipolar disorder, or something else. So it's really important that if diagnosis is the thing that you're looking for, you take your evidence. You can take the NICE guidelines printed out with you, and sometimes it's up to us to advocate and educate, unfortunately. But any useful healthcare professional, doctor, would say, okay, well, let me look into it at least, which is what mine did in the end. So it's about having all the information there ready to kind of fight your corner if you need to. Yeah.
Before I move on to the results of some of the questions that I posed to the listeners, I just want to read out one more fact that I found out about PMDD that I found really quite surprising. And that is, according to the official PMDD health website, PMDD is classed as a disability under the Equality Act. That to me is baffling, because people think of PMS as just being something quite mild and, not something almost tangible like a disability as such.
Yeah, I know.
That really surprised me that it's classed as an official disability.
Yeah, and I think that's where the whole diagnosis argument comes in, because for me, diagnosis was really important, but I wouldn't class myself as disabled. However, there are so many people in the UK and around the world who are fighting for, often unsuccessfully, but as awareness increases, people are managing to be able to claim for kind of disability benefits and things like that, which it's hard to get those claims through, and there's unfortunately people tend to be rejected a lot before they're accepted for it. But it's being seen as real and a disability. It's becoming more,
I guess, more considered in the workplace, more considered within the general public, perhaps.
And there are some really good resources actually on the IAPMD website, which I think is what you're referring to, and they have kind of workplace support resources, so things that can help your employer to support you, even things like risk assessments like we would do for maternity, doing the same kind of thing for somebody with PMDD to be able to support them with their work.
That's really good.
So that's a great website to go to.
So next I want to move on to some of the poll answers. So I put some questions out to the general public. So this poll in general, the whole theme of questions was all about hormones. Not just PMDD, not just PMS, but hormones versus mental health as a whole. And I was going to finish with this question actually, but based on the results, I think it's wise that we actually start with this one, just because I feel like it might impact the results of the other statistics. And the question was, what sex are you? The options were male/cis male, so assigned male at birth, female/cis female, other, and prefer not to say. And 80% of the people who answered were cis female or assigned female at birth, and 20% were male or identified as male. So I just wanted to clear that up so that we can maybe discuss, I guess a lot of the people who were interested in this poll tend to be women due to the nature of menstrual cycle, hormone cycle, that kind of thing. So I then asked, do you notice or have you ever noticed a correlation between your hormones and your mental health? And the options were yes, majorly, yes, sometimes, maybe / it's hard to tell the difference, and no / I've not noticed. And 52% said yes, majorly.
Wow.
That's a lot.
It's one of those things that makes me feel shocked, and then I kind of go, oh no, actually that makes so much sense.
Mm-hmm.
You know?
Yeah.
Because it's shocking, but it's actually not shock at all.
Yeah, I completely understand that. I think because so many of us, especially if you've menstruated for a long time, you get so used to your life just being like that, and you don't think about your mental health because you expect your period to come, and so you never associate the two. But actually, if you really think about what you're like the week before your period or 2 weeks before your period, you do often go into a low patch.
Yeah.
And that's very normal, and because it's normal, we just disregard it.
That's right, absolutely. And again, like, even with PMS, as I said before, PMS in itself is still valid.
Yeah.
But it's if you think, oh, well, it's just PMS, it's just normal, I've just got to get on with it. To some extent, I get that, but equally, if it is causing disruption, if it is causing pain and trauma, that's not okay.
Yeah.
You can't just put up with it because, and I use quotation marks here, because you're a woman.
Yeah.
That's not what we should be doing.
Yeah. We then had 35% said yes sometimes. So again, that's still so high. 13% said maybe / it's hard to tell the difference. So a few people are still struggling to recognise, I guess, that correlation, as we've just discussed. And 0% said no, or I've not noticed.
Wow. Oh
0.
my goodness.
Isn't that shocking? So either people are very aware that this is a connection, or they're not quite sure about the correlation.
I almost think some people, they might be kind of a little bit on the fence because they just can't believe that their period could do this to them.
Yeah.
You know, because I remember reading that tick list when I first found out, and I read the symptoms and I just thought, what? Really? And even then there's still some kind of self-gaslighting, just kind of like, you can't have that, like, yeah, like, no, like, surely not.
Yeah.
I think there's so much denial because, again, it's just seen as the thing to do, is to get on with it. It's something as well that up until very, very recently, I think 2020, topics like PMS and PMDD weren't taught on the curriculum in schools.
Right.
So what that means is they had like sex education, but in terms of period health and expanding on that, it wasn't even covered.
That's interesting.
Only a few years ago. And unfortunately that's in England, but in Wales these topics are seen as optional.
Really?
And that to me just says a lot, doesn't it, about kind of the whole, how you view menstruation as, oh, it's optional, so it's not a priority. And unfortunately that's the next generation. And that's why I think awareness and just talking about it, and PMDD is menstrual health and mental health. It's the two worst taboo subjects.
Yeah.
And that's why they don't get talked about. It's why it's so unrecognised and misdiagnosed. And ultimately, it's probably contributing to those 30% of people who've attempted suicide, because they've probably felt like they were losing their mind. They didn't know why. They didn't have answers. They didn't have support.
Yeah.
And that to me is why this is so important.
Following on from that question, I then asked people, do you take any steps in controlling your hormones so they don't impact your mental health? And I gave a few different options for this, including yes, medication, yes, therapy, yes, other, and no. So I'll start with the biggest result, and the biggest result was no. Which in a way, is that people who don't know that there is support available? Is that people who are worried about the risks of support? Is that people who feel they don't need the support? You know, there's a lot of things within that.
Do you know, I just want to grab those people and say, like, you've just answered to say that you think that you have severely impacted symptoms because of your menstrual cycle, and you don't have support. And like you say, why is that? Is it because they don't know if it's available? I personally think it's because they just don't think that they should have support. They think they should just get on with it.
Yes.
And that's not true at all.
Mm-hmm.
It is hard to find therapists who specialise in PMDD and hormones and things it is hard to find the right support. But again, if you take away the label of PMDD and just go with your symptoms to, say, a therapist and say, this is how I'm feeling, that's where they can support you, that's where they can help you.
Yeah.
Oh, it's such a shame that people don't get the support they need.
Yeah, absolutely. I mean, considering as well the results from the last one, it is the same percentage, more or less. Next was, we had 25% said yes, other, and they have listed a few of their other the specifications, so I'll go into that in a moment. 15% said yes, medication, and 5% said yes, therapy. So we've had a few people comment with regards to what they do for other support. And somebody said, I don't know whether you've heard of this, I take ashwagandha supplements and maca powder in my drinks as these help to balance hormones.
Yeah, I've heard of the first one, ashwagandha. It's not something I've tried, and I think people who have maybe known they've had hormone issues for a while might be able to relate to this. When you find something that works enough, you're very reluctant to change it or to tweak it even. So for me, the medication that I take, it keeps me stable. It gives me, it's enough, and it doesn't mean that it's, makes me 100%, but it gets me up to maybe 65%. I don't know. And so I'm very reluctant to play with that now. I just think I just want to stay on that medication and not change anything. Yeah. Don't blink the wrong way. Don't look at it wrong. But I've heard lots of people mention that actually and had positive results. So that's really good, and it gives hope, doesn't it?
Yeah, it's really good to know, because something like that as well. I mean, I don't know for certain, but I presume that that's not prescribed. That is something that's just accessible from your own accord.
Yes, that's as far as my understanding is, that you can just buy it from over the counter or online.
Interesting. We've had a few comments with relation to the contraceptive pill, and two different answers in a way in whether it helps or whether it doesn't help. And this is a difficult one because it varies so much on a case-by-case basis. Yeah. Everybody is different. Every cycle is different. Every hormone, every reaction is different. So you really can't generalise with something like this. But someone said, when I stopped taking the pill, I became far less anxious and on edge all the time. And someone else, similarly, said, the pill as a contraceptive made these lows even more erratic, I found. But since having the injection, very, very few mood swings at all and no period. It's the only thing to have ever helped, and I found that last year after 15 years of having a menstrual cycle.
That's so good that they found things that work for them, because that's the whole point. Again, there's no cure. Treatments vary so much. If you can find something that works for you, it's gold dust, and you must hold on to that and protect it at all costs. And it's interesting because I've tried various contraceptive pills, I've tried the injection, and none of them really agreed with me. Yeah. And I guess, if we look at the science behind that and going back to it being a sensitivity in your brain, it could be that you're estrogen intolerant, it could be that you're progesterone intolerant, or it could be a bit of both. Yeah. So different contraceptives are going to affect you differently to, somebody else. Yeah. And that's where it's so hard, especially when you could have 10 people say that something's worked for them and then you try it and it makes you worse. Yeah. And you just feel so disappointed isn't the word. Again, you probably blame yourself and say it's my body's fault or my fault. Yeah. And so it's so hard if you're trying things and they're not working, especially because none of them work instantly. They take months to get into your system and have the impact that they have. So I would just say to anybody who's trying things and they're not working, give yourself a break. Yeah. If you're trying things after trying and trying, maybe just go back to basics and then start again. Because it's so easy to just keep trying things, and I think all the while you're just adding more things to your body, and your body doesn't know if it's coming or going, your brain doesn't know if it's coming or going. Yeah. Just kind of go back to basics for a while and then start again. Yeah,
and even then, you might find that something you tried a while ago has a different impact, because I found this. So when I first went on the contraceptive pill years ago, I eventually found one that worked for me, and I was on that for years. Mm-hmm. And ended up coming off it for 12 months to have a break and just kind of regulate everything. And when I went back onto the same pill, I had a completely different reaction to it.
I had a similar experience actually. So I remember one of the very first contraceptive pills I went on, I was on it for a while and then I came off it, and when I went back on it, it just didn't have the same effect.
Yeah.
And I have no idea why.
It's very it's very strange. And then I guess you're questioning, is it me? Have I done something?
Yeah, you do. But another point actually though is you don't know if brands are changing. So
Very true.
If you get your prescription and the brand has changed, it's a different company, although the medication is the same, the ingredients could be different and you could react differently. So it's just an absolute minefield.
Yeah, it really is. It really is. And it's just about being patient. I mean, you can try 10 different pills and none will work. I mean, after I went back onto that pill and had a bad reaction to it, I must have tried about 5 different ones. And you trial them. I guess they give you, say, is it 3 months before your body has to... Yeah. So I was on these 5 different pills for so long, trying them all out. And my mental health and just me in general, I was all over the place. And it was, I think there was one pill, I can't remember which one it was. I tried one that absolutely turned me into a bit of a monster, and I had no idea until I came off it. And it was like a black cloud had been lifted, and I was like, oh my God, like I was arguing with everyone, I was getting angry all the time, I was really angry on it, really angry, and I thought it was really justified. I was like so stubborn, I was right, and it was only coming off it, I was like, oh my God, that wasn't even me, that was some other part of me talking that doesn't even exist.
And I do think that's where the whole spectrum thing is important, because you could take somebody who experiences, say, normal PMS, and you could give them some sort of change, whether that be a contraceptive or an SSRI for something else. As soon as you change something in somebody's body, they could react to it. Mm-hmm. And therefore, you might not have known you've got a sensitivity until you have something that you're sensitive to.
Yeah.
So it's really interesting just how it can affect people. And as well, PMDD doesn't necessarily start when periods start during puberty.
Okay.
So it can be brought on after a pregnancy.
Oh.
So some people can be muddling through absolutely fine, and then they get pregnant, and after the pregnancy, they're kind of like, why do I feel like this? And again, that's where misdiagnosis comes in.
Yeah, I think it's postnatal depression.
Yeah. And it can be both. You can have postnatal depression and PMDD. Or it could be that you have 3 pregnancies and it's the 4th one that triggers it.
Wow.
And then as you get older and go into perimenopause symptoms can exacerbate PMDD symptoms. So it's just, at that point, it can be really hard.
Yeah.
Yeah.
We have had somebody who mentioned about being in perimenopause. So somebody has messaged in to say, I feel hormones have an effect on our lives from puberty. They're massively associated with mental health. I'm perimenopausal, and that is having an incredible impact on my mental health.
Yeah, that's not a surprise at all, because during perimenopause, your estrogen, your progesterone and your testosterone are all in decline. So if you're sensitive to these things and all of a sudden they're in decline, and then maybe they're going up again and going down again, and they're all over the place, because that's what perimenopause is. Actually, anyone with PMDD, you can see how they're going to suffer and how they're going to struggle. It's really, really hard. Perimenopause isn't something I'm looking forward to at all for that reason. But yeah, it's just what that person says just unfortunately makes total sense.
Yeah. So speaking of the self-care and the mindfulness, I suppose, that we mentioned earlier, self-compassion, a couple of people have said just having that mindset as it approaches makes all the difference. So someone has said, knowing that I'm going to be unstable the week before my period helps take the pressure off. And someone else has said, being able to use mindfulness to remind myself that this too will pass.
Oh, I love that. Absolutely love that. And something that I always kind of use is a bit of, I call it a PMDD toolkit. So, it's having the things in your back pocket for those harder days, like gratitude, fresh air. And let's face it, any of those things in isolation are not going to help you. Let's face it, let's be really honest. But if we look at it holistically and practice these things consistently, they will impact your mindset. They can really, really help. And for me, it's things like the grounding technique. I don't know if you've heard of that, but I'd encourage anyone to Google the 5-4-3-2-1 grounding technique, because that's just so helpful in just getting you out of your head for a minute, which I think is half the problem sometimes.
Yeah, it really is. Really is. We've then just had a few additional points that people have sent in, or questions. Someone has said, the mind boggles at how many misdiagnosed or undiagnosed women or assigned female at birth people there must be out there.
Yeah, absolutely.
And we've talked about it, absolutely.
Yeah, because again, 1 in 20 have it, but that's only a prediction based on the diagnosis that already exist of those patients, plus people who have been diagnosed with something else or have been not diagnosed at all. And I'm kind of going to scratch the surface of PME here, which is like a whole other this could be a whole other episode of your podcast, but PME is premenstrual exacerbation of another condition. So for example, you could have bipolar disorder and PME. So you live with bipolar disorder 365 days a year, 28 days of your menstrual cycle. But during your luteal phase, which is ovulation to your period starting, you have it exacerbated.
Wow.
So it's exacerbated by your symptoms, and that's really hard to diagnose. PME isn't actually a diagnosis in itself yet. It doesn't exist as a diagnosis.
Right.
It's more of a concept that's being researched at the moment. But basically what it means is if you're living with a condition all the time, and not just psychological conditions, they can be physical conditions as well, but they're exacerbated during your luteal phase, that's premenstrual exacerbation of another condition. Another example is fibromyalgia, PME of fibromyalgia. So people do report that they have more flare-ups when they're due on their period.
Right.
So it's definitely linked to their hormones. So that's just, there's so many different ways that you can look at PMDD and PME. It's no wonder that people don't know about it
or associate it as something else.
Yeah, absolutely.
Yeah. Oh my goodness. Someone has asked, any tips on dealing with the panic attacks or anxiety?
Oh gosh. I think for me, when I'm in a phase of panic attacks and anxiety, I know I need to get out of my head. And I hate to say this because I know it sounds a bit crap, but that for me is when like the fresh air comes in. And not because it's nice fresh air, it feels good. It's taking yourself out of your surroundings and putting yourself in a different environment. And that's, to me, what the fresh air thing is about. It's not necessarily that the sun feels nice and warm or, the wind feels good. It's taking yourself out of the environment you're in and physically putting yourself somewhere else can really help you to get out of your head. And again, that's where the grounding technique really helps me as well. They're the two things that I would say are, in the moment, the most helpful things. But if those kind of small wins aren't really working, then I think it's taking on something a bit more significant, maybe medication, things like that. Because if you're living with these things and they're affecting you all the time and you're not getting any kind of relief or you can't navigate your way through them, you don't deserve to be just feeling like that. And it's definitely worth kind of getting some support for it.
Yeah. And in terms of seeking medication, is this something that you're best approaching a GP about or a sexual health clinic? Like, where does this fit in? Because this is an awkward topic for a lot of people who don't understand it.
Yeah, so first port of call is GP. And then when they have kind of reached the end of their expertise, it would be gynecologist.
Right.
But so far, I've been referred to a gynecologist, but not heard from them. That was a few years ago.
Okay,
so I'm still on some sort of list for that, yes. But it's okay because I feel like at the moment, on the treatment pathway that I'm on, it's okay. So I'm happy to share that I take fluoxetine, which is an SSRI. I take it every day, so 28 days of my cycle. But during my luteal phase, I double dose. So I would just like to say this is something that my doctor and I have decided. It's, something that they found out from the NICE guidelines. It's not something you should just do.
Yeah.
But for me...
And is that to help you with stability during that phase?
Yeah, so what I find is it helps to just bring the lows up a little bit. And also, people often say that when they're taking SSRIs, they feel kind of foggy and not themselves.
Okay.
So by having kind of half the dose the rest of the month, I feel like it's not robbing me of those good days. It's not robbing me of my energy and my enthusiasm for life because it's only half the dose. And it's been proven, there's some research into it that says if you just take SSRIs in luteal only, so 2 weeks on, 2 weeks off, there's no side effects, withdrawal symptoms. So you can take them quite safely, 2 weeks on, then come off them for 2 weeks. But again, obviously speak to your doctor first before doing that.
And can you take this medication alongside contraceptives, or does it work not necessarily as a contraceptive, but in terms of like a hormone impactor, I suppose?
Yeah, you absolutely can. All I would say, and I think doctors would probably say the same, is don't try to change too many things at once.
Yeah.
So if you've been taking an SSRI and it's working okay, but you feel like you could benefit further, then maybe think about adding in something else. And it's the same with chemical menopause as well. You can take chemical menopause medication, which basically just suppresses ovulation temporarily, so it's not permanent. And then you can also be taking SSRIs on top of that. So again, it's a lot of things are kind of in conjunction with other things as opposed to working on their own, unfortunately.
Mm-hmm. And for someone who is approaching menopause, do you have any tips on that regard, or ways of dealing, or ways of regulating, or...
I think regarding menopause and the approach to menopause, we all know that there's lifestyle changes that you can make. So that's kind of, thinking about your diet, your exercise, and don't take for granted the impact that those things can have, because they can affect your hormones, which is, what menopause is. And also think about your stress hormone, which is cortisol. So when you're going through menopause or the approach to menopause, your cortisol levels can increase as your estrogen declines. So you're just going to feel stressed. Stressed and more stressed, and because you're not feeling great, you might feel more stressed, and because you don't know what's causing it, you might feel more stressed. And typically people who are going through menopause, they'll have children at home who could be going through puberty.
Yeah.
So that's a terrible combination. Yeah. And they could also have elderly parents who they're trying to care for, and they're also trying to kind of, succeed in work. They're trying to keep a house and trying to kind of keep fit and healthy, and there's just so many other things that
you're spinning on a lot of plates in general, aren't you?
So hard. So I would say if you're perimenopausal, don't discount the help that you could get from HRT. So HRT, again, it's a whole other episode, I'm sure. But just to say, there are over 70 different types of HRT.
Wow.
So if you're perimenopausal and you're thinking about HRT, or you've heard bad things about it, don't write it off. Just speak to your doctor about it.
Yeah. And be patient. Not the first thing couldn't work for you, the second thing might not work for you, but the third might.
Yeah.
Or the 10th.
And if nothing works, well then hopefully by the time you've tried them all, you'll be postmenopausal anyway, and your PMDD's gone.
So I suppose once you've reached the menopause, I guess the PMDD, does it just disappear forever, or does some of the mental symptoms still linger?
So trauma, I imagine, still will linger. But also, when you're postmenopausal, you can still have symptoms, because when you reach menopause is only one day, which people don't realise. So you're perimenopausal, and then once your periods have stopped for a year, you're menopausal. And then after that day, you're in postmenopause then. But what that doesn't mean is that everything's normal, because you're still going to have no estrogen and no progesterone than you did have. So some people will be on HRT for the rest of their lives, which also means that some people can have symptoms for a very long time in postmenopause, which can include PMDD, but not necessarily just PMDD. So it's really hard to say, yes, PMDD will go away, but I'm optimistic that during postmenopause, if you're looking after yourself, or you're on HRT, or you're just lucky, actually those symptoms will be very minimal.
Okay. One final point is someone has written in to say about how men don't quite understand the severity of hormones. And I think I'd just like to touch on this just from a partner's perspective. What can a partner do to help you cope with a difficult hormone period, and especially PMS or PMDD?
I think the main thing is to remember that they're an individual first. So I'll tell you what helps me now, and somebody else could think, oh God, that's terrible. Yeah. I'd never want that. So for me, I just need space.
Yeah, okay.
I don't want a hug. Do not try it. Do not approach. Do not try and cuddle me. Don't give me sympathy. Just treat me like normal, but give me space. And that's because for me, as soon as I get sympathy, it makes me feel weak. And when you're in PMDD, you don't want to feel weak, because that's just something for the PMDD to attach to. Okay. So for me, I just need space, maybe some gentle assurance, but really, I don't want to fuss. But another thing, and this is actually a really big deal in our house, and it's something we argue about all the time, is make the decisions. So every night in our house, it's, what do you want for tea? I don't know, what do you want for tea? Do you want chilli? Could do. Or do you want curry? I don't mind. And these are the conversations we have all the time, and we laugh about it. But when I'm in PMDD, I will say, I can't make decisions today. I just need the end results. So you make the decisions and I'll do it, or you sort it. And it's whatever you decide, I'll agree to, because I don't feel like I have the brain power to make decisions. And to try just makes me feel really stressed and overwhelmed. So I'll just say, please just make the decisions today. We laugh about it, but when I'm in PMDD, I'm like, please just make the decisions. So I would say that's the main thing.
Yeah, I guess on a similar note to that, something that we're very good at in this house is communication in general. Yes. And having your partner just be on the same page as you and know why you're feeling like that in the first place, and know that it is approaching, and know know what to do. I mean, you might not know what to do yourself, but for them to just understand that this is going to be a difficult time, and not I don't say don't take it personally, that's not my point, but just understand that things will be a little bit difficult for that person, and have that open and honest platform to be able to talk about it if you need to, and have the assurance that your partner is just going to understand that that's a difficult time, and they're not going to get mad at you if you get snappy, and they're not going to call the doctor if you start crying for no reason.
That's a really good point, because as I said before, you kind of have to accept that it's a real health condition, and that also means owning it. So it's so easy to be in denial and think, oh, maybe it just won't hit this month, maybe I'll be fine. And the danger is then, of course, that you don't kind of let your partner know, or your family members know, that this is going to happen. Or you expect them to just, read your mind. And actually the best thing you can do is just kind of say, just so you know, I've just hit ovulation. Yeah. And it doesn't have to be a huge, let's sit down and talk about it conversation. It could just be, I'm at ovulation, things are probably going to feel a bit tricky right now, or just bear with me. Yeah. And I think that's enough just to kind of say, watch out, basically. Yeah. So, having those open conversations, I think, is really important, and not even, as I say, I don't like sympathy. I don't like to kind of be emotional. So I'll be open and honest, and then leave it there and say that this is where I'm at. Yeah. Have the information. Yes. Do what you like with it, but do not give me any sympathy.
Yeah. Thank you very much. This has been so informative. Oh, and good. I think hopefully a lot of the people that are listening as well will have learned something from this. So. Because as we said, it's not something that is talked about very often.
Yeah, absolutely. The more we can kind of talk about menstruation, mental health, it can just help one person, and every person counts, every life counts, doesn't it? So thank you so much.
Thank you for joining me. Thank you to Laura Teare-Jones for joining me for today's episode of the Calm Within the Storm podcast. Today we talked all about hormones and PMDD. I hope you found it helpful, and I shall leave you with some helpful resources at the end of this episode, including a link to the official Premenstrual Disorders website and also a link to Laura's own podcast, My Hormones, My Health. Here's what we've got coming up in the next episode. We'll be talking all about dealing with your mental health during parenthood. Whether you are already a parent or considering becoming a parent, hopefully you can find this next episode quite valuable. If you would like to learn more about PMDD, PMS, or any other premenstrual disorder, you can visit the official website now, iapmd.org. If you would like to listen to Laura's podcast, search My Hormones, My Health by Laura Teare-Jones on Spotify, Apple Music, and all other major platforms. Once again, thank you very much for tuning in to the Calm Within the Storm podcast. My name is Sam Lyon. It's been a pleasure. Thank you for listening. See you soon. Everything can change.